Welcome to the session on budgeting for Tracker. It will be a relatively high level session. I won't go into a lot of detail, but I hope that I can give you a couple of tools in terms of what costs money when it comes to Tracker projects. We will not give you any concrete numbers, but we do have some high level estimates based on our experience. Budgeting for Tracker is especially important as the projects can involve sort of complex configuration work, lots of users, training, to mention a few things. In my day-to-day job, I do help countries to budget projects, and I manage distribution of finances between lots of different countries. So I have some experience in this. Also, our HISP groups, the ones that are involved in day-to-day project management in each country on the DHIS2 projects, are of course good on the details. So you can also reach out to them to get their experiences. But I hope this can be helpful. So after this session, my aim is that you will be left with some key points on some of the key building blocks that needs to be funded in a health management information system based on DHIS2. We do see that there are some sort of key elements that you need to fund over time for a system to be sustainable. Only to receiving sort of innovation funding, for example, to build something new and fancy, that's very well, but there are still some key sort of foundational building blocks that requires funding over time. Also, I'll talk a bit about which areas requires funding for Tracker projects, and also a bit on how funding Tracker projects is a bit different from funding aggregate data systems. And also that you need to keep a long-term funding perspective if you're planning a Tracker project. And I'm open to questions as we go. I don't have the Slack channel open, but I'll get one of my helpers here to shout out if you have, or just, I think we're a pretty small crowd. So you can also raise your hand if you have a question, and I'll try to answer it. So budgeting is really important in a project. And budgeting properly and early is important for more than one reason. It's important for more than just making sure that you have enough money for your project. It also serves a tool for conducting a cost-benefit analysis in the beginning, meaning that you do a conscious evaluation of whether the costs of doing the project outweighs or if the benefits outweighs the cost of doing the project. So is the investment worth it? Doing Tracker can be quite expensive. It can cost a lot of money over time. Will it be worth the investment? It can also serve as an activity to set mutually agreed expectations. So it's tempting to do as you see on the picture here on the right. The client wants something, and then the budget doesn't really match the realities of what they want. So actually creating a budget and communicating that well, it helps to set expectations that are mutually agreed, that all parties of this project understand. So maybe you will have to choose something over another. Maybe you choose an integration with an external system, spend your funds on that, or do you scale up to another province, or do you do point of care data entry over secondary data entry, for example? Do you choose to procure more devices? Then maybe you have to leave something else out. So doing a budgeting process at the beginning of your project is important, and also revising it as you go, as conditions change. It can be an important tool in planning with a project owner. Again, it sets mutually agreed expectations, and it also highlights to people who are not down into the technical details of the project and the nitty-gritty of how you plan to go about doing this project. If you can show them that we plan to do this at this point, this will cost approximately this much. We need to ensure that we have funding for this activity at this point. It serves as a good sort of project communication tool with the project owner and other involved stakeholders as well. Having a proper budget can be important to communicate with the funders of your project. For DHIS2, it's quite often funded by various funding agencies like Global Fund, Gavi, other development aid agencies. Often they require a budget. Often we at his BYO, who are sometimes managing larger contracts, we require a very high level budget. Doesn't have to be very, very detailed, but so we get an idea of what are the upcoming costs, and so that we can also forecast going forward. How many projects can we fund with the pool of money that we have available? And during a budgeting process, it's also important to forecast future needs of funding. Doing a tracker project, it's not done in 2 months and then you're done, then you can leave. You don't need more funding. It's an ongoing process, and there will be funding needs as long as this tracker program is alive. So getting that upfront and onto a paper or an Excel sheet is important to have a sustainable system. And all these topics, in a way, they contribute towards a sustainable system. So if you don't communicate well with the project stakeholders, or you're doing a project that costs more than the benefits are, or you don't communicate well with the people who are providing the funding for your project, you will not have a sustainable system over time. Yes. Often when we think about what costs money with doing a tracker project, or any IT project for that matter, it's easy to think that, okay, we need to secure funding for that consultant to come and do the configuration of the system. We need someone with tracker expertise that can come in and that can make sure that the system works in practice. So we can test it and it works. And then we're done, in a way. That's a very, very small part of a tracker program that needs funding. So in this figure, I just tried to illustrate that all these boxes represent costs to your project, and configuration/maintenance, that's one small element of that. But you also have to pay, for example, at the facility level, at the lower level, maybe that's where your users are, you would have to pay for capacity building, training, to teach people data entry, how to validate the data analysis and use. There are costs associated with connectivity, buying devices. At the district level, you will have similar costs, but here you would also have to factor in things like supportive supervision. Who will pay the person who is going to drive out to the different clinics and help them out now and again? We know that that's very beneficial to have a sustainable tracker system. That needs to be factored in to the equation. And also, at the national level, the actual configuration, of course, it might cost money. Either you have staff on hand that are qualified to do it yourself, then maybe that cost isn't so high, or you have to hire someone to do it. That might be more expensive. But you would also have to think through, and that's been presented in the previous sessions, you need to do stakeholder engagement, gathering requirements, really figuring out what are you trying to build. That can cost money, renting a meeting room, providing lunch and tea and whatever. Maybe paying per DMs to people to participate, or their time to participate. You need to pay for the server management, mobile device management. I'll come back to that a bit later. And also making sure that you have a strong core team. That's maybe not your concern budgeting for your tracker project per se, but having that sort of foundational crew in the country that are knowledgeable on tracker and that can help troubleshoot, etc. That also costs money. Core team salaries. It's the people that are on the ministry IT team, that they get paid over time. Doing tracker, it's very, very important to do field testing. I think there are several presenters throughout the academy that have talked about the importance of testing out in the field, what you make, and adjust accordingly. You need to budget for that, for traveling, sleeping in a hotel if you're going far, etc., and time to analyze and write up your report afterwards. And also monitoring, evaluation, and feedback. I'll talk about that a bit later today. I wanted to pause a little bit here. Does anybody want to share experiences there? I mean, some of you had worked previously on tracker projects. Does this resonate with your experience? You can raise your hand if you would like to share a little bit of your experience. Any hands? No hands? That's fine.
Anna, maybe I can just share one of my experiences.
Yeah.
I was working, and so I work a lot with the WHO packages, and so I was working on an implementation of one of those packages, and I think you'll get more into this into your project later, but it was interesting because a lot of with these WHO packages, it's kind of like there's an intro package. There's a core set of technical assistance. You know, somebody comes in for a week, they do some training, they set up the system, and then they that's that money, and then it's gone. But you still need to be able to do training at a national level. You have to still procure all of the devices. So I think it's an interesting concept to know what you're getting with each pot of money. Really make it clear to know how to extend that pot, how to work within multiple pots of money, how to pull it together. But for me, that was an interesting experience of just being able to see there's an intro cost, an intro pot of money, and then you need something more for sustainability.
And that's often the challenging money to get hold of, the sustainability money. I mean, many people are keen on funding new and exciting things, but really mapping out and planning your project well, and also linking costs to every box is important, because I think it's really a shame. I mean, available funds to do IT in healthcare, it's a limited amount of money, and it's a shame to waste a big introductory pot of money if you know that it's not going to be sustainable, if you know that there's no money available to pay for connectivity or to replace devices in 2 years' time. Should you really make a huge upfront investment on configuring, gathering stakeholders, etc., etc.? Then you could spend that money on something else.
We have a comment in the chat.
Yeah.
It's from I guess the cost of generating resource, knowledge, material are part of the capacity building.
Yeah, you could say that. Yeah. So that's a very good point. That could be a separate box, really. I mean, this is one way of representing it, and you could formulate it differently and add. But yeah, generating resource and knowledge material, that's it's quite time consuming to build. I mean, building a course like this as well, it requires lots of that we're holding now these 2 weeks. It's time consuming, takes a lot of people away from their day-to-day work. Making slides, it takes time, and sharing, and really, if you're making good training material, it's time consuming. Yeah, very good comments. Okay, we have another. In my experience, the budgeting is very critical to the implementation in the right way. We had a program implementation the system can run, but still not taking an exhaustive approach will improvise the process. In many cases, the quality will be the first thing to compromise. Yeah. And sometimes, you don't. It's the same with budgeting in your private life. Sometimes you don't want to know what things cost because it's uncomfortable. I can relate. You get paid, and then you have all these things you want to spend your money on. And if you were smart, you would write it down properly, and you would know what costs were coming up front. But then you really want that thing. And in a way, it's the same often with these tracker or IT projects in general. It's just, did we really want that functionality? We really want that integration. And wouldn't it be super cool if we could get rid of all paper and everybody have their own device? Because it sounds super sexy and it sounds like a very good idea. But if you don't add some numbers to all these decisions, you'll, as the commentator says, the quality will be compromised. Very good. It's very good comments. So, you know, maybe many people, they would think the budgeting is a boring part of the project, and maybe it's not what triggers you most about working on a tracker project. But it's also a shame if you see your project fail 6 months into the project because there's no money left. Any other questions, or I'll move to the next slide. I'll move on. But again, feel free to raise your hand and jump in. Oh, do you think extra costs is required, an implementation level facility for hardware or mobile device repair and maintenance costs? It can also be managed or handled by the district. Yeah, so I'll get back to that in a little while when we're talking about specifically Android considerations. You could assume, I think Jaime will talk a little bit more about that, but I guess you can assume a certain sort of shelf life for a device. I'm not sure if it's 2 years or 1.5 years. Often they will be used quite sort of, if they're used every day for tracker and they're carried with out in the field back and forth, maybe it's even shorter. So you need to think about this. Replacing devices over time, and they may break, they get stolen, suddenly they don't work. Yeah. But sometimes inflation of the budget will make departments refrain from the implementation, but it should be split into phases. That is a very good question. So if your budget numbers are way too high, you won't even get out of the starting blocks, right? Because people say that this is unrealistic. So again, then maybe you should reduce the scope, make the project simpler with fewer moving parts. Yeah, I don't really have a very good answer for this, but it's a very valid comment that inflating. It's but again, think of it as being realistic. And you also have to know sort of your funder space on what you're doing. If you're working on tuberculosis, or you're working in malaria, or you're working on school management systems, I mean, familiarize yourselves with possible sources of funding for your project. Ideally, if it should be funded through the ministry or the government agencies itself, you know, that it has true, like putting money into something, it means you have true ownership of the system. So relying on just sort of outside finances all the time might also be a signal that it's not necessarily something that the ministry is putting their hearts and minds into.
I just want to make one more comment. My experience in Rwanda was very interesting. They have a strong DHS2 foundation in Rwanda. And I was in there and they were talking about, okay, we want to implement this EPI tracker for immunization. And they were discussing different avenues to go. Maybe we'll go with this other funder. They were looking at getting that contract with this other venue, but they said, but we do have DHS2 on the ground. It's functioning. It's in the country. So let's just have this as an interim, this EPI tracker as an interim while they continue working on this other contract. And in the end, DHS2 was on the ground. It was functioning. It was up and going. And so in the end, that actually won out because of the foundation within this country of DHS2. The sustainability was there, and so it got chosen in the long run.
Yeah, and we have Abdul here from Afghanistan also making a valid comment, saying that it's important to know who is asking for the system. Like if it's coming from the leadership, they often also sit on the money. So if there will be willingness to have sufficient budgets for all boxes for the long run. But the idea is pushed by lower level people, then there are hurdles. Yeah. That's very good. But even I think also very often if it's coming from leadership, we would like to do a tracker for tuberculosis or for mother-child health or for whatever. it might come from the leadership, but they don't know how to budget this. So you will know which cost categories you have to take into consideration. So maybe that's where you have to present your budget and say, I hear that you really want this fancy system, and it's good that you have some money for it, but have you thought through funding all these different things? Maybe they haven't. It depends on how well versed they are in this space. There's a question generally, what are the plus minus percentage change in implementation as compared to planned budget? I don't know. I don't know. Perhaps splitting the phases into chronological chunks with a respective budget. As soon as the implementation starts, the funds might be in a better shape due to many stakeholders are engaged. Yeah, that's a very good point. You could say that if you're proving, if you can show to stakeholders that your project has momentum, it's really giving value, you're providing data that's super important for making decisions. We're going to talk about monitoring and evaluation later. If you can, through your monitoring and evaluation work, really show to good results that by doing this tracker program, I'm achieving these results, this is better than it was before. It's also easier to be funded more, right? That people can now pour more money into it to make it sustainable. So it's not like you will have all the money you need for a 10-year operation upfront, but you need to think a bit longer than just the configuration work. Suleiman says that I think that it's very important to know how cost can be supported by all stakeholders before began all things. Be sure of that, otherwise the project will fail. Yeah. This is not an easy exercise at all. Both doing the budgeting, it's a bit like a little bit like putting your finger in the air, and maybe you will hit the nail on the target, but most probably it will not be 100%. But at least it makes you think through all the different categories where you will need some to put aside resources. Yeah, that's a lot of very good comments in the chat. Thank you so much. Just keep them coming. So in this project planning template that you have received, we're operating with a few different budget templates depending on what kind of project we're running. The project planning template that you have is based on this figure here, and I'll go through it now. I also have a slightly simpler one that we have used for COVID in the past months, and I'll show that as well, and I can also share this. But funding tracker, it differs from funding aggregate data collection and use. But however, it also relies on the basic funding needed for reporting aggregate data. And in other words, if the basics are not functioning, implementing tracker will be very challenging. So just doing tracker in isolation is more difficult than if you have a well-functioning HMI system supporting it. So this figure here, it shows some of the basic funding blocks of a sustainable HMIS, the blue boxes. And these areas, they sort of have to be funded regardless of tracker or aggregate reporting. And the green boxes on top, they illustrate programs that strengthen the data repository with more fine-grained data. For example, tracker data, individualized data. And finally, on top, there is a yellow box that illustrates apps to enhance data visualization and use. And I'll cover this a bit more in detail in the coming slides. So these are 4 of the basic boxes here. So it might not be your responsibility to ensure that there are funding to support a solid HMIS team in your country. But still, it's good to keep in mind that that's part of the pool of cash that needs to support your HMIS. And also, as I said earlier, it's a lot easier to do a tracker project and maintain it over time if there are stable staff in the ministry's IT department, for example, somebody that can help you if you're stuck or can advocate for you, etc. And it's also easier to do a tracker project if you have competence on doing regular configuration cleaning workshops, if you have trained server admin staff that are up to date on the latest security considerations, for example. So the 4 boxes here, if you're starting with DHIS2 from scratch, You will need some design and configuration workshop work. There are user trainings involved. Maybe you have to work on importing legacy data from other systems. Devices and connectivity, both at the national level and at lower levels. Maybe there is need for interoperability support. And then if you want to, one thing is setting up a DHIS2 instance from scratch, but then if you want to keep it sustainable over time, and you want to maintain this data repository in a clean state over time, you will have to factor in money for refresher training. People who are trained in year one, they might have to have some refresher training later. Maybe configuration cleaning workshops now and then to look at the configuration because it gets messy over time. Activities around revisioning tools because requirements change. Sometimes you have a form for collecting aggregate data that looks like this in 2017 and it looks very different in 2021. And that needs to be reflected in the system. Again, connectivity, device replacement, and interoperability support over time. So you interoperate with another system in year one, but again, that system changes in year three and you will have to adapt. There are costs associated with server infrastructure and administration. It's the actual server hosting costs. And it's also the server admin training and guidance, including maybe TA, technical assistance from outside. Excuse me. And then we also need to fund the DHIS2 core team in a country. This is paying for salaries or maybe secondments from other departments. People often need some sort of incentive to stay on the team. They can get better paid jobs outside of the ministry IT department, for example. How do you incentivize them to stay? Yeah, core team trainings, academy sponsorships, etc., to make sure that the staff, the ministry IT staff are up to date and have the latest and greatest knowledge. These are the other 4 boxes that you could see on the as the foundational building blocks. You should sort of have a continuous focus on working on data quality and data use. So that could in doing that, you could add costs in terms of installing and adapting WHO packages and data quality tools to your system. This is maybe more for aggregate, but still. Training of trainers to make sure that you have good quality trainers that can train health facility staff again. And then, of course, big costs associated to user trainings. And the same data and district and facility level data use, same here. Both assessing local level data use, understanding is data being used at the facility and local level. This might mean traveling, visiting the field, visiting clinics, visiting district offices over time, several different ones to understand, is my system being used as I intended? Are they getting the data they need out of the system? If not, why not? And how do you help them? And then I spoke a little bit in my previous session about the need for proper governance and coordination in an HMIS. There's some costs associated with that as well, to have sort of the key stakeholders in an HMIS gather, maybe say quarterly, to discuss where are we going next, what are our priorities. So that could be to just organize these meetings, so a getaway, and also perhaps outside expert guidance. And then there are evaluation and supervision costs to do regular meeting to evaluate if we're going in the right direction, to monitor, and etc. So these are some key costs that are sort of running all the time. You might not have to think about it specifically for your tracker program, but that's sort of also the funding that you're competing against. So if your tracker program gets all the HMIS budgets, that means all these blue boxes are unfunded, and then you have a problem pretty soon. And then I'll get a bit more into what costs money for tracker in particular. So for Tracker, you have to budget for design and configuration workshops, including TA. You need to budget for field testing, prototyping. Like once you've done your configuration, you need to check if it's working in an actual setting. Testing with different devices, is your support structure functioning? You might need to procure and field test different type of devices, different types of keyboards, large screens, small screens, mobiles, Chromebooks, what works in your setting. Some things might work in the urban setting, maybe it works with more like a laptop, while you need a smaller screen that you can carry with you in a more rural setting. You need to set aside time and finances to test this out, and don't sort of assume that one approach works for all, and don't procure all your devices before you have even tested. So maybe you start small and you try it out, and then once you know what works, you can make an informed decision and do the rest of the device procurement after that. And same with field testing. Workflows can be very different at different clinics. Is it working in practice? Do we have to go back to the drawing board and reconfigure our tracker program? So setting aside both time and resources to do this field testing work properly. You need to set aside time to do training of trainers once your project is up and running. Connectivity, devices, and also assessment, evaluation, and monitoring of your projects. I'm getting back to that later today. Any questions so far? Okay, we'll move on. Here's a lot of numbers, and I can share the Excel sheet with you afterwards. This is, at the moment, we're working a lot with COVID, as I guess most of you are, and we communicate with a lot of different countries regarding rapid scale up of COVID tools. And I'm just showing the very high level budget that I'm sharing with them to just highlight the core costs of getting a COVID system up and running. Again, this doesn't really show a long-term perspective. This is how to get it started. And what I think this template illustrates pretty well is the difference between local costs and TA costs. So we can say the TA costs we can estimate pretty well because we know more or less what a HISP or DHIS2 expert might cost. The local costs can vary a lot from country to country, and that's something you will always have to do when you're budgeting your project, is to look at what does it cost to train a health worker for half a day in my country. And that might have huge implications on your project cost. If you're training 5,000 users and the cost is $15 or $150, of course, your budget is this or your budget is this. So you can see here all the yellow numbers. For example, on the top one, vaccination site end user training, we're doing aggregate vaccination and stock reporting module. If you have 1,000 users that you want to train for half a day, and the unit cost for that is $33, that's $33,000 out of the total budget. And for doing installation work, customization work, you could sort of split the cost into one cost is the cost for TA, and then one cost is to cover the local team to participate or to rent something or. Yeah. And then in terms of tracker, I want to sort of put your attention to the second item here, electronic immunization registry package. This is tracker. So the other ones are mostly aggregate, but the electronic immunization registry, so registering every person who is receiving their COVID vaccine, will fall under this. And you can see here that the cost for package installation and customization is higher than for the aggregate one. You can see here that for here, we've estimated that you would need 3 workshops instead of 1 workshop to be able to customize the package, because doing tracker is more complex than doing aggregates. you get closer to the health worker's workflow. It's not that you enter 10 numbers at the end of the month, but you might work in the system every day. It needs to work in the workflow, in the physical workflow of your of the problem you're trying to solve. So it requires more time to configure it. You also need to do field testing, as we put here. It might not be that important to do field testing for aggregate reporting, where you are reporting a number more seldom. But if you are actually going to enter data 200 times every day, you need to it's extremely important to field test it, and you have to budget for field testing. And again, here, end user training, it might be more complex to learn a tracker program than to learn an aggregate program. So you might need more training. Maybe half a day isn't enough. Maybe you need 1 day, 2 days, 3 days, depending on how complex your system is. And you have to factor that in. So again, I can never give, no, if you ask me, what does a tracker program cost? You can never give that cost, because it depends on the complexity, it depends on the scale, it depends on the local costs, etc. And then on the bottom of this COVID, on this, I'll get to your question afterwards, Abdul. In the bottom here, you also have costs for mobile deployment if you don't already have devices deployed. So you would enter in costs for devices, mobile device management to make sure you're keeping track of the 1,000 phones that you have put out into the world. You need to ensure that you can update them from a central place, or that you know if they're functioning or not, who owns them, etc. Mobile device management, that has a cost, and connectivity. There was a question here, what activities or items are involved in field testing? So under field testing, it is typically travel, per diems, hotel, gas, time for a consultant maybe to help out. Any other? Thank you. Yeah. Yeah, and Kim comments here, with tracker implementation, it's important to make sure your server and hosting is up to par, because tracker takes more. Yeah, that is very good points. I see we haven't actually added, we added server hosting here. Yeah.
Anna, what's the difference between trainer of trainers and end user training?
Yeah, so doing training of trainers, this might be collecting 20 district staff in a classroom for 2 days, where you are teaching them how to use the tracker program and how they should communicate this to the end users. So maybe going through the training materials with them, if you've created that, or it can be discussing training approach, showing them how the system works in detail so they can communicate that onwards. So it's often a smaller cost because you're doing it once, and it's one classroom. Maybe you need one teacher, one classroom, few people. But then end user training, that is the actual health worker or education manager or whoever is using your tracker program that needs to learn how to operate it. And very often that means a lot of people. Yes, I will share there's a question if I can share this cost sheet, and I will. Maybe one of you others can find the link. It's on the DCHIS2 webpage under COVID tools. So if nobody else will do it, I will do it after the session. Share the link to the Excel sheet. And again, the numbers are, it's pretty high level, and you really need to be conscious about your own setting, your own local costs. For some places you might have a server already where you can host your program. You don't have to pay for more server rent. Maybe in some countries, training end users are not really an extra cost. People are willing to do it on their free time. Other places, people won't show up unless they receive a huge per diem. It's very individual from site to site. And some people are making a very simple tracker. Maybe a couple of configuration workshops are enough. Others have huge complex tracker programs with complex integration works, and of course, that goes up as well. So this is just this is an attempt to make something very high level and as a communication tool. For how long do we need to keep the training server instance? Good point. Are there anyone else on the call that maybe have experience here and could answer? Jaime or?
I'm here if you want.
Yeah.
I can answer to that. Of course, I think it's going to be a very vague answer because it's going to really depend on your implementation. But I don't think it's a bad idea to keep a training or a testing instance for as long as you run the project. Yeah. Because probably at one point you would want to make changes, and ideally you should never make these changes in production. So you will implement those changes, and probably you have to train your users on those changes. So probably you would like to keep. The good thing is that this training server instance does not need to be as powerful probably as your server. So you will probably be able to run this as a much lower cost. But I think it's a good idea. Every time we release something or we make changes, these changes should be made in a different server, not in production. So I could keep an instance which can be called staging, training, testing, whatever, for as long as the project is running. At least this is what I've been doing. This is what we did at the NGO I was working for. And I think it's a very good way of working.
Good. You can just stay on, Jaime, because the next one is about funding considerations for Android. So you can run through that slide as well. You're on mute.
I'm here. Sorry. Yes.
Yeah.
yes. So thanks, Anne. I'm going to be talking for some minutes about Android. I'm going to be covering what I already covered in the session that I did on Android, trying to link a bit more what Anna has been saying. But basically, for me, the main thing that you should consider when you implement Android is that it's not only the cost of devices, but what Anna put on the previous slide, there are things associated to the devices that sometimes are not taken into account. So it's very, very difficult for us to give you a full list detail with what you should be including or not. So these are some hints. I think Anne put like 3, 4 on the previous slide. But just take into account that when you implement Android, it's not only the device, but many more things that will come linked to it. And apart from training, reconfiguration of the server to adapt it to your tracker, mobile program, etc., there are some things here that I will mention, which, for example, is the devices. Sometimes you think you can be working perfectly with phones, but depending on your projects, imagine you have a project like I've seen in Gambia where they need to enter a lot of text. You're going to probably want to have a keyboard, or you even would like to, instead of have a phone, have a tablet because it has bigger screen and bigger keyboard, or even a Chromebook that it's a laptop running Android that has the keyboard attached to it permanently. I think Anne mentioned as well, repair costs. Mobiles are going to be there out on the wild pretty much every day. They are more likely to be broken much more often than desktops. So plan that, I don't know, it's hard to say. I think you would need to analyze your environment, but maybe you want to have like in stock, like 10% of devices or spare parts that you could use in case your devices break. Maybe if your project is really critical, you need to make sure that these devices are close to the facility where the data is being collected, and maybe have even more if it's extremely critical. Yes, that's very good, Kim, as well. What Kim is saying, and this is something we advise on the guidelines, whenever you buy devices, make sure you can get them locally, or that you have extended support period of time, or that you have replacements. Does not make sense if you're working in, I don't know, in the west part of Africa, that you come to Europe to buy devices, because they will be likely difficult to be replaced, difficult to be repaired, etc. So make sure you can find a procurer. I think you say procurer locally that can provide this. The same way, gadgets. Sometimes you will have to budgetize for external keyboards or power banks. Imagine you're going to have people going on the field for 3 weeks, and you have very unlikely you will have electricity, or maybe only electricity when they go back to the facility, but maybe you want to budget for power banks or specific devices with higher capacity of battery, etc. So this a bit in terms of devices, let's say, like physical stuff. But other things that should not be forgotten is mobile device management. I think I put there like $12 per month per device. We know it's very, very expensive, and most projects might not find the cost benefit in a good radio. But make sure that if you do require a mobile device management, you budget for it, because I know in one implementation they did the budget for it, but only for the first 2 years. So after 2 years, they could not extend it, and they had to stop it. And actually they did not stop, but they went from the premium service offered by the MDM to the basic, and the basic was not covering the needs. For example, the features could not allow to manage the application from the console, so it was a bit worthless. So make sure that if your project is going to last for 5 years, maybe you want to allocate enough money for the mobile device management. Again, it's expensive, but I think you need to do the analysis there. And then just to end up with connectivity, I've seen other projects, I'm not going to say fail, but I'm going to say that they became a bit slower because of the connectivity problem. Sometimes when doing the project management, they had allocated some money for mobile data bundles, and they say, okay, every user will use this amount of money, let's say $10 per month. The problem is that it was not include the process of distributing these. So by the end of the month, some users had exhausted their data bundles, and they had to wait for 2 weeks to get these new bundles, because in the process it was not included how these things were going to be distributed. So this is money because of the bundles, but also maybe money because of how you're going to manage this. Are you going to be traveling there? Are you going to be sending them by post? So try to include these kind of things. And yes, to finish with this last sentence, zero rate URL or agreement with telecommunication operators. I know some countries are doing, and it's becoming more and more frequent. Ministries of Health are finding agreements with telecom operators in order to be able to send free SMS or free data towards a specific URL, or maybe it's not free, but you pay completely in a separate way. This could really help you in the sense that you could avoid all these costs that I was mentioning before, that you need to distribute data bundles, you need to buy them, which probably will include a lot of overhead. But if you find this agreement and you say, okay, every device can freely use, or I will pay $10 per month per device to the telecom operator, it's something that will remove a lot of other work you need to do. So there are things that you need to plan in advance when you're budgeting. Think, okay, am I going to implement Android? Yes, no. If yes, have I looked at these points I'm listing here? There are probably many others that I have not listed, but they will apply in your implementation. And trying to make it a bit more exhaustive. My English today is not the best. Just make sure that you consider as many things as you can, because it will really have an impact, and it will be a pity that because you did not plan ahead, your project would fail. That's all, Anne. Thanks. I'm gonna still stay here in case you need anything of their questions. Yeah.
Thank you so much. Thanks. That's great. There's one question here in the chat from Botswana. Are there any possibilities of hosting a tracker program on the cloud? If yes, what are the cost implications as compared to the on the premises server hosting? So yes, you can host it in the cloud. You gotta, of course, look at your at the legislation and policies for hosting sensitive individual data that applies in your country. If they have any, they might have they might give you direction whether you need to host it in country or it can be on the cloud. In terms of costing of server hosting on the cloud versus on the premises, I am actually not sure. Maybe somebody else on the call can answer that quickly.
I can take that as well if you want. So yeah. I would say that in general, having them on premises is going to be cheaper, because you will pay for the connection, and the server, it's likely to be, well, cheaper if you have it on premises. However, it will include overhead, so it will include maintenance. You need to pay for this side. So again, you need to do the evaluation. But what is important to know is that tracker programs are very likely to have higher costs in terms of servers, because you're going to have many more, much more data to be dealt with, and you will need to increase a lot the features of your server. Having said this, if you could put on premises, it's more difficult to scale up, because you probably buy a server and maybe your project is small, so you want to buy a small server, and then you need to add like new processors, new memory, and this is harder when it's a physical server that you have on premises. While if this is on the cloud, usually clouds are much more scalable, because what they do is they give you a chunk of this huge server like this, and then they can increase. So if you need to maybe deal with very sensitive information, you might comply with the law better if you're on premises. If you're going to go on the cloud, maybe you need to do a further analysis where this data is being kept, if they're following the standards. As an example, in Europe, if we're dealing with patient data, we need to have the servers in Europe because of the general GDPR. So you need to look at this locally. But in terms of physical specifications of the server and the connectivity, premises will likely be cheaper, but you might lose this possibility of scaling up in the future.
Yeah, and we've got some links here to hosting on the DHIS2 site. Thanks, Kim. Perfect. Thanks, Jaime. I hope that answered your question. My next slide is just to highlight that really it's the number of users, sites that matter in terms that's driving up the costs. And that's sometimes harder to get funding for, these local costs, than to get funding for TA. So very often, for many projects at least, through HISPU.io, we can help with covering TA costs through various contracts that we have. So we can help with getting that one person to help you configure your system, but that's not the big cost of your tracker program. So I put two different examples here. The pink one is a tracker program for RNMNCH, for mother and child health, in 5,000 clinics. Everyone is doing mother-child health, lots of babies being born, big country maybe. You see here we've factored in some design and configuration workshops with 3 weeks of TA from a DHIS2 expert, some participant per DMs. We have added in some field testing, which is good. Here it's also some TA cost, and maybe 4 or 5 core team members from your IT team participating in the field. We've set aside some on-demand remote guidance by global regional experts, training of trainers. Then we have user training and devices and connectivity. So you see here that we say that we estimate that it costs 2 days per users a year in year 1 and in year 3, about 1 user per clinic. So you have 5,000 clinics, so you need to train 5,000 users, and let's estimate that that costs $200 for training an end user for 2 days. Maybe they have to travel somewhere, or I don't know. You need 1 device per office, $200 per device. Again, it's an estimate, might differ from case to case. And you need to think about connectivity, so say $20 for connectivity per user office per year. So you can see here the total cost of this project over 3 years is 3.3 million. Oops, very sorry. While the yellow one at the bottom here, it has exactly the same cost categories and the amount of work for doing design and configuration, field testing, on-demand, remote guidance, etc. But here, this is maybe a tracker program for tuberculosis. Maybe there are 500 clinics in the country, or it could be less. And you see that this is really what's driving the cost, and the cost of this program is like 1/10 of the other one. So that's something to just keep in mind, that the number of users, the number of devices, how much you're going to train them, that's really what drives the cost of your tracker program. We're getting near to the end. I think my last slide here is that you need to budget for a long time. I mentioned this before as well, but this can just illustrate it very, very high level. So say, for example, that you have this very simplified rollout plan. In phase 1, you plan to design and configure and scale to 2 regions of the country, perhaps. So you need to configure and field test in Q1 and Q2. You're going to work on training your users and then rolling out devices and rolling out the program. You have a phase 2 in the next year where you are training and rolling out to 5 additional regions, for example. And then in phase 3, you will scale up to the rest of the country. But here you would also start to retrain your users from phase 1, because now the people that were employed in the 2 regions here in the beginning of 2020, when you get to 2022, you need to factor in that in region 1 and 2, people might have quit. There's staff attrition, people leave, new people come in. People might have forgotten what they were taught 2 years ago. Maybe you've changed the system based on feedback, so now the system looks a bit different. So yeah, this slide doesn't give you any numbers, but it gives, you need to think about your tracker program over time. I think I will end it there. Thank you for all your really good comments, and we will meet again at 11:45 in half an hour. And please just keep posting questions on Slack, or you can email me at ann@dhis2 if you have questions.